Hi, everybody. It's nice to meet you all. I like to say good evening or good morning or good afternoon, wherever you are. We are going to present today a webinar. I think you will find it very interesting. It is elimination of rabies by 2030. Our first speaker will be Professor Rehab Tash from Egypt, ZagaZig University. She is a professor of medical microbiology and immunology and infection control consultant and auditor. She is certified as associate trainer. And she is an author and editor of infection control books in Arabic and English. Please, Prof. Rehab, go on.
Thank you, Dr. Fatma, for this invitation. Happy to be here with all audience, my professors, and let's begin. We will speak in this session about some synopsis of rabies virology, pathogenesis, clinical picture management, and the immunoprophylaxis of rabies disease. First of all, in the 21st century, rabies remains as one of the most feared and important threats to public health. 40 to 50% of annual deaths toll are children younger than 15 years. Human rabies fatalities probably underestimate. 50% is underestimate. And 98 of the human rabies cases occur in developing countries, to which should all the modalities for prevention be directed. Rabies virus belongs to family Rhabdoviridae, which came this name from the rod-like shape under electron microscopy. It's negative sense RNA, non-segmented. Here comes the name of order Mononegavirales, and it belongs to the genus Lisa virus. Actually, Lisa comes from the name madness, the typical form of the clinical symptoms of rabies. Genotype 1 is the classical rabies. Other genotypes of Lisa virus genus also can infect humans. Professor Scott will go through the reservoir and vector. Just a hint, all mammals are susceptible to infection by rabies with different susceptibility. Here's the diagrammatic form of the structure. Glycoprotein, which interact with the cell receptor, nicotinic receptor, mediating the cell entry. The RNA genome coding 5 proteins. Most importantly for diagnostic modality is a nucleoprotein, is the target for antigen detection test. The typical replication cycle of RNA negative sense viruses in the cytoplasm. Here we can recall the historical Negri bodies, the eosinophilic inclusion bodies found in the cytoplasm of the infected cells. This is typical replication cycle. Again, Professor Scott, Professor Morales will go through the epidemiology and the vectors. Just I wanted to emphasize the bat rule. It will have special consideration in the immunoprophylaxis and the management of cases in contact with bat as a cause of rabies. Here, infectious cycles can be urban rabies, mostly dogs. 95% of human cases of rabies are bites of rabid dogs. Second most common cause is cats, while sulfatic rabies in wildlife contracted from bites of wild carnivores. Direct contact with infected animal is the most common mode of transmission of rabies. The good news is intact skin is immune against virus penetration. So contact leaking of rabies virus with intact skins, there is no risk of transmission of rabies. However, abraded skin there is a risk. The bite of the raped animal is the most common cause of transmission, but not the presence or absence of symptoms will determine the transmission or not. Is there a virus in the saliva or not? Some lucky person, the virus in the saliva may be cleaned from the teeth by the closing, and not the bite won't transmit rabies. The virus may not present in the saliva due to intermittent secretion from the raped animal. However, again, bats, a bite of bat can be ignored, and even any contact, because bite of bat may not be perceptible and impossible to rule out, especially in children and sleeping person. WHO has 3 categories of risk of exposure to rabies virus. Category 1 is considered as no exposure, just as we said, intact skin has no risk of exposing to virus. Category 2, no bleeding of the wound. Category 3, again, bat comes to the photo, and mucous membrane with saliva exposure by aerosols from bats is category 3 with all the precaution applied. We should also come through the rare mode of transmission through corneal and organ transplantation mediating human-to-human transmission of rabies, human working at bat caves, aerosol exposure, laboratory accidents, and even animals are exposed to rabies via aerosols from bats. So the virus after bite, after mucous membrane exposure, will incubating for 1 to 3 months medium, 10 days, even to 1 year. We should consider this because the length of the incubation period depends on the dose of the virus inoculum, whether it's through skin or mucous membranes, was bleeding, deep tissue destruction, reaching a nerve ending, and how long the virus will have a journey from the lesion to spinal cord or the brain. And of course, the vaccination status of the patient. The virus will go through from the bite site, replicate in the muscles, neuromuscular junction up to the spinal cord. All these 5 stages, the patient has no clinical signs. Once the virus reaches the CNS, begins to multiply, immune response begins, cytokines release, chemokines, this inflammatory encephalitis will begin to show the clinical signs of the rabies virus. Then it goes down to get the exit route through the salivary gland, where it have another round of multiplication to go out through saliva. So the patient will experience pain, paresthesia, pruritus at the site of bite, prodromal stage for malaise, typical for any virus infection, headache, and then comes 80% of human rabies cases will show encephalitic form of rabies, or minor cases paralytic rabies. At this stage, we can detect rabies nucleic acid in saliva by nucleic acid detection methods. So encephalitic rabies is a classical form with hypersalivation, excitement alternating with lucidity. There is a difficulty swallowing this hypersalivation, and it will progress to pharyngeal spasm. This pharyngeal spasm makes the patient experience hydrophobia, and all this will be progressed rapidly to coma and generalized paralysis and death. The paralytic rabies is less dramatic. Progression to coma has a longer time to go. Here there is an ascending paralysis in contrast to the encephalitic form. Once paralysis reaches the respiratory muscle, respiratory arrest occurs, and this happens. It's a 100% fatal disease. However, hydrophobia is not a prominent feature here. As we said in the CNS, multiplication of the virus, upregulation of the cytokines and chemokines, all this leads to CNS dysfunction and multi-organ failure. In spite of all these clinical pictures, which may appear for some of us pathognomonic, no, hydrophobia is highly suggestive, but Differential diagnosis of other agent and syndrome should be considered: other viral encephalitis, tetanus, lead poisoning, listeriosis, both in veterinarian and medical field. Even co-infection with other infection as malaria may lead to misdiagnosis, so we are going to lab diagnosis. Lab diagnosis has stages, all the stages: historical, direct microscopy, Nigri bodies, has no rule now in the modern lab diagnostic methods. Demonstration of viral antigen, fluorescent antibody techniques present since 1950s, but still has to be equipped lab with fluorescent microscopy, etc. Virus isolation for by mice or rabbit tissue culture, and serological testing of antibody in the serum of the patient. The new modalities for diagnosis of rabies now in market, using more rapid test, 1 or 2 hours for direct immunohistochemical test or indirect. And of course, nucleic acid detection technique has the upper hand in the genotyping, sequencing, surveillance, epidemiological studies, more than the regular diagnosis of cases. Management, unfortunately, no effective therapy exists. Literature has many trials which may succeed once and fail tenths, and so on. Just excellent medical care with ICU is important, and the basic. We are back to the basics, wound care, and we will see how suspected animal monitoring, administration of rabies immunoglobulin, and rabies vaccination. Wound care, at least 15 minutes of washing with soap and virucidal antiseptic is mandatory. No suturing, never to suture up unless absolutely necessary in case of severe bleeding. In case you have to suture the wound, you should infiltrate rabies immunoglobulin first. Bleeding is category 3 and indicate immunoglobulin, and analgesic, antibiotic, and tetanus according to the clinical evaluation of the physician. If the animal biting the patient can be humanly euthanized, so test for rabies. If confirmed to be rabies, okay, go on in your post-exposure prophylaxis. If not, discontinue the post-exposure prophylaxis. If it's a valuable animal or domestic dogs and can't be so just put under monitoring for 10 or 14 days. And accordingly, you can decide if the animal shows the signs and symptoms of rabies, continue the post-exposure prophylaxis. So what is the immunoprophylaxis of rabies here? It goes many updates, and WHO recent update by 2018, and it's a post and pre-exposure using the cell culture or embryonated egg vaccine. This is the recommendation now. Still, nerve tissue vaccine are sensitized and marketed in some developing countries, and the promotion for the new vaccine should be ongoing. According to the risk of exposure, as we discussed before, the vaccine or no vaccine, vaccine plus rabies immunoglobulin is indicated. If the patient is a repeated exposure case, we should go through if it's more than 3 months or less than 3 months, this repeated exposure, and he has already received the complete post-exposure prophylaxis before, nothing is needed, no vaccine, no rabies immunoglobulin, just wound care as we discussed. If more than 3 months, that means that the antibody level is waning in the serum, so you should give the post-exposure prophylaxis for previously immunized individual, as we see now in a minute, but there is no need for rabies immunoglobulin. Intradermal injection of the vaccine is the best now. It reduces the vaccine cost by 60 to 80%. In low-income countries, this is a huge sum of money. So, but the vaccine manufacturer should announce that this vial can be used for intradermal. Otherwise, we can't use it for intradermal regimen. It decreases the visits, clinic visits, better patient compliance, good promise to complete the regimen. For immunologically naive individual, for all age group, for lactating, for pregnant female, it's safe to administer 2-site intradermal vaccine on day 0, day of bite, then 3 days after 7 days. There is the 3 doses of 2-site intradermal. Each injection is 0.1, while the intramuscular injection, 1 site for 4 clinic visits, 0, 3, 7, and 1 day between 14 and 28. You can reduce this by making the first day 2-site intramuscular injection and make it 3 visits only. And don't forget to give the rabies immunoglobulin film category 3. Remember, this is naive individual not vaccinated before. For previously immunized individual, there is just 2 doses, 2 shots, 1 site intramuscular on day 0 and 3. And this is here the art of intradermal injection of rabies vaccine. In 1 day, you can have 4 size intradermal injection, and that's it, with no return. For rabies immunoglobulin, we can calculate the dose according to the body weight, either equine or human-derived rabies immunoglobulin. Remember that category 3 is completely indicated to have rabies immunoglobulin. It inhibits the viral spread. It's injected into and around. This is the latest recommendation for rabies immunoglobulin. And from day 0 to day 7, it's okay to give rabies immunoglobulin. Otherwise, after day 7, there is no need. The neutralizing antibodies of the vaccine given on 0 is becoming rising in the serum of the patient. However, all patients with immunodeficiency, whatever the risk of exposure, give rabies immunoglobulin. All bats exposure, again, bats came with its risk. All bats exposure, spectrum bites, scratches, even aerosol exposure to mucous membrane give rabies immunoglobulin. And if the case of the animal is confirmed of probable case by lab, so give rabies immunoglobulin, whatever the wound condition, whatever the category or risk. So for people who have risk of exposure to rabies, we should give pre-exposure rabies prophylaxis. The vaccination is recommended for all ages. It's safe, cost-effective. Now there is calls to generalize the rabies vaccine for children in rabies endemic areas. And it's only 2 shots, 1 site intramuscular regimen in 1 week, or 2 site intradermal regimen in 1 week, 0 and 7 days. We can just a reminder, the injection of rabies virus never to be in the gluteal region. You have deltoid area or anterolateral area of the thigh for children under 2 years. For intradermal injection, deltoid region or the suprascapular region or anterolateral of the thigh. Never inject rabies virus vaccine into gluteal region. If there is a drop in the series of vaccination, just 2 doses, the second dose given anytime. There is no need to restart. For immunodeficient patient, we add another 3rd dose in the day between 21 and 28 days after the last dose. Boostering. At 2018, WHO have its recommendation. However, CDC and the Advisory Committee of Vaccination have the newest update by May 22 for person working with live rabies virus in diagnostic research labs, vaccine production labs, titer check for antibodies every 6 months after the vaccine shot, the 2 shots we discussed before. You should titer check every 6 months. If the titer falls below 0.5 international unit per milli, revaccinate by 2 doses. For person handling bats, having contact with bats, or live enter high density bats like caves, environmental worker, and so here titer check every 2 years, and the booster dose is given after the titer fall if the titer falls below 0.5.
Dr. Rehab, Dr. Rehab, you have 3 minutes remaining.
Yes, doctor.
Okay.
For veterinarians, technician, animal control officers, and their students or trainees, person handle wildlife reservoir. One-time titer check during years 1 to 3 years, according to the local health authority, and give booster dose accordingly. Or you can just give booster dose for those personnel every 3 years and not sooner than day 21 for the better memory, call, and immune response. This is the booster dose for vaccination. Thank you for everyone.
The second speaker will be Professor Alfonso Rodriguez Morales. He is an expert in tropical and emerging disease, particularly in zoonotic and vector-borne diseases. He is president of the Publication and Research Committee of the Pan American Infectious Disease Association, as well as the president of the Colombian Association of Infectious Disease. He is a member of the Committee of Tropical Medicine, Zoonoses, and Travel Medicine, and vice president of the Latin American Society for Travel Medicine, and member of the Council of the International Society for Infectious Disease.
Thank you very much for the introduction and for the invitation. Now I will focus on the global epidemiology of rabies, and these minutes I will speak about a little bit on the importance of rabies for human health, about the global epidemiology, and 0 by 30 as an epidemiological target. In first place, as has been already addressed, from the human point of view, this is a very important still viral zoonotic disease that may progress and may cause a fatal inflammation of the brain and the spinal cord, leading to these clinical forms that have been presented. And it's important to recall on the relevance that this is a vaccine preventable disease, but still unfortunately kills tens of thousands of people each year, and of this case approximately 90% are acquired from the bite of infected dog. So it's important to remember that this may lead to severe complications of the central nervous system, such as the cerebral edema that may be severe and may lead to the fatal outcomes. And you may have this kind of outcome at the central nervous system with these histopathological findings that are very characteristics of the neurite bodies. We have the problems of the incubation period that may be really long, and I will discuss on epidemiology precisely some recent case relating to this situation. We have to remember that we have the initial symptoms, but also rabies specific symptoms, including hallucinations, light sensitivity, insomnia, and especially hydrophobia, excessive salivation, aggression, among others. From the epidemiological point of view, precisely, rabies is still estimated to cause 59,000 human deaths annually in over 150 countries, with 90% of cases occurring especially in Africa and Asia. But also, I would like to highlight precisely, and in Colombia based, the situation here in Latin America. And we have to remember that 99% of the cases result from dog bites, that 1 death occur every 9 minutes worldwide, and 4 out of 10 deaths are in children. But precisely, this is a vaccine preventable disease, and what we are targeting is no bite, no rabies, and that is precisely part of the objectives in 0 deaths by 2030. It's especially important to remember that although we have the bites, we have other animals that may be involved, that this occurred especially in poor rural communities, but also in some regions, as it's happened, for example, here in Latin America. This occurs, for example, even in urban area. And this is important then to prevent rabies transmission, not only from dogs, but especially from dogs, especially remembering that vaccinating dogs saves human lives. Rabies is 100% preventable, and vaccinating 70% of dogs may break the rabies transmission cycle in areas at risk related to those dogs transmitted rabies. As I was mentioning, and this will be discussed later in detail, I would like to remember that in the epidemiology, it's important not to consider only human aspects, but environmental and animal, and this is part of the One Health approach, that we have multiple animals that may be involved in transmission. For example, here in Colombia, in the epidemiology of recent outbreaks, for example, the fox has been involved in recent case, for example, last year in the north of the country, which is especially at risk. For example, here, this is in the case of Colombia, most of the cases of animal rabies has been related to this area, the Caribbean area. And especially the last year, these were related to cases where foxes were involved in transmission to human cases. But additionally to that, and this has been part of the recent discussion, for example, of the Rabies in the Americas conference that was held just a few weeks ago here in Colombia, that in some countries, which is the case of Colombia, for example, in the epidemiology, cats are also involved, and cats may transmit the hematophagous bat lineage of rabies, and can be a link between wild rabies and human cases. And this has been occurring, for example, here in Colombia after the importance, obviously, of dogs, but cats are involved in 15% of the cases, as well as other animals, as has been discussed. In this way, it's important to mention, this is part of one study we published last year related to the fact that also farm animals, cattle, bovine, are also part of the animals that we need to surveillance in the country, as these blue areas are cases of bovine rabies in Colombia over this period of time. And we have to remember that the transmission is also related to environmental aspect, that has been in some studies, and this is one of our groups many years ago in Venezuela, related to eco-epidemiological aspects. Right now, here in terms of the farms animals, there are mapping of the risk areas, for example, in the south, which is part of the jungle areas that are shared with the Amazonian areas, the Pan-Amazonic region in Latin America. Globally, it's interesting to see, for example, that obviously we have been reducing or decreasing the number of human cases of rabies, including not only in general, but from domestic animals, from bats and other wildlife. But it's important still, as has been stated in the United States, the increase in detection, for example, of rabies among wildlife, in different species, including raccoons, skunk, bats, and foxes over the years. And certainly, as I mentioned, in the continent, in the Americas, it's important to consider, obviously, the importance to reduce dog-transmitted rabies, but we have other cases mediated by other animals. Right now, and has been also discussed in the Rabies in the American Conference, it's important to highlight, for example, in the region, which countries are important in that way, in terms of still cases of rabies transmitted by dogs, including Haiti, Venezuela, Brazil, Bolivia, Mexico, and even Peru, that a few weeks ago had not only a case, but a fatal, important case that has been reported in the country. You may see that between 2022 and this year, 70 deaths have been associated with confirmed cases of human rabies in the region. As I mentioned, this was just the last month in Arequipa, Peru, a 54-year-old female with confirmed dog-transmitted rabies that unfortunately died. This had a long period of time between the bite and the development of symptoms, and unfortunately problems in education, in coverage, and promotion, and other aspects that were related to the fact to these healthcare problems in attending this case that unfortunately led to a fatal outcome. From the surveillance system in the Americas, it's interesting also to see the reduction in the number of cases I mentioned, including the human case by dogs and other species in the region, but still, we have to consider and to remember that we have still cases, and this is important as the goal is to reach zero with this. You may see here the countries, especially the case of Brazil and Mexico, reporting cases all over the period of time. But as I mentioned, in some countries, it's important to mention that there has been some changes in the transmitter animal. For example, in Argentina, also the situation with cats, in an important proportion, for example, in Brazil, Colombia, as I already mentioned, in Cuba, but we have other kind of exposure different to cats and dogs that we have to remember, including bat, bovine, fawns, among other animal species. You may see here the diversity in the whole group of countries and the whole diversity of the species that have been reported to the surveillance system of the Americas. But still, the goods are good because globally we are reducing in general the incidence. This is a standardized incident of rabies globally, regardless, for example, the different factors. Obviously, in some countries with a better social demographic index, the reduction is even higher, as has been stated, and also by age groups, as has been reported in this study. And in general, after adjusting, still the regions of the world with the highest problem are Africa, especially in Central African countries, Sub-Saharan countries, and in the East African countries, but also in Asia, especially including the case of India and other countries. Nevertheless, in some countries, there has been some interesting change that we have to consider in the approach, because in some places, in addition to that, there are increase or decrease. For example, in Latin America, there has been a significant decrease in the proportion of cases compared to the different periods. But in other, for example, there has been an increase, as you may see in red, for example, although this is in less than 5%. Nevertheless, as I mentioned, the socio-demographic index is statistically significantly associated. Improvement in social conditions are also associated with a significant decrease in the epidemiology of rabies, and has been commented in this paper by Gan and colleagues in the International Journal of Infectious Diseases. In the past 30 years, Mexico, Costa Rica, Brazil, and other South American countries had really curbed the epidemic of rabies because of the efforts of the government and the people. Obviously, this rabies global burden has shown a remarkable downward trend over the past 30 years, but still in underdeveloped countries, rabies still causes deaths and data that can be or not. And I mentioned the example of Arequipa in Peru that has occurred very recently. In this way, and just to finish, we have to remember, as we published this year in this editorial, that the target is to have 0 deaths related to human cases of the dog-mediated rabies, and this is related to different objectives that are stated in this goal to have the 0 by 30, including to consider also not only dog-mediated rabies, but we have to look after that in other kind of exposure that will be discussed. And it still is important to consider more research and generation of evidence to highlight the situation. On September 28th, for example, the Global Rabies Day, for example, in the Latin American Society for Travel Medicine, we highlight that, especially because among travelers, this is important. And we are part right now of the United Against Rabies Forum, which is interesting that this week is having this forum, the stakeholder meeting. You may participate, it's online and free. And we have participated this last month in the Rabies in the Americas conference, which is an important opportunity to highlight also this aspect and to remember, for example, also that in travelers, rabies is an important condition because the exposure in still Dutch transmitted rabies risk area, as has been highlighted in multiple studies. I will not discuss this any further, as has been already presented regarding the pre-exposure immunization for rabies, pre-exposure prophylaxis, the guidelines. But just to conclude, I would like to mention that rabies remains as a significant public health concern in many parts of the world, and there are several major challenges in global epidemiology, including the lack of awareness, the insufficient surveillance and reporting in some areas, the limited access to post-exposure prophylaxis, the stray dog population that needs to be controlled, the importance of wildlife reservoirs that will be discussed later, the vaccination coverage, which is very variable according to continents and countries, the problems in cross-border transmission, including the recent problems in migration that are related to different situations, war, forced migration in different countries, the access to healthcare, and finally, cultural and traditional practice as well, also anti-vaccination sentiments that also affects in the case of rabies to having an important effective and safe vaccine. Finally, my last slide is important, the efforts to address this challenge, including this aspect that has been highlighted, and that international organizations and governments work together to develop and implement a strategy to combat rabies globally. I would like to invite you to our Congress in August 2024 from the Latin American Society for Travel Medicine and the International Society for Travel Medicine and the Congress of Infectious Disease in Rio de Janeiro. And thank you very much for your attention.
Thank you, Professor Alfonso, for this very informative and an excellent presentation. We'll leave also the discussion to the end. Now we'll move to Professor Dr. Scott Weese. He is a veterinary internist with a diploma of the American College of Veterinary Internal Medicine and a fellow of the Canadian Academy of Health Sciences. He is a professor at the Ontario Veterinary College, University of Guelph, director of the University Center for Public Health and Zoonosis, and chief of the infection control at the Ontario Veterinary College Health Sciences Center. Is a member of the tripartite global leaders group of antimicrobial resistance and chair of the WHO advisory group for critical important antimicrobials in human medicine. Dr. Scott will speak about the role of various animal reservoirs in the transmission of rabies. Please go ahead, Professor Weese.
Great, thank you very much, Fatma. Yeah, so I'm going to talk about reservoirs, vectors, and how rabies gets transmitted at a fairly high level. So if we look at kind of this overall schematic, which is quite simple, we've got reservoirs, we have vectors, and we have incidental hosts or dead-end hosts. Reservoirs are animal species that maintain this virus in circulation in nature with their own rabies virus variant that I'll get to later. So we have canine rabies, we have red fox rabies, we have skunk rabies, we have bat rabies. And the transmission within the reservoirs is predominantly within those species. So where we have canine rabies, it's predominantly dog-to-dog transmission with a potential for spillover to other species. Same thing with bats, same thing with foxes. There's transmission within that reservoir population. There can be transmission between reservoirs. It's fairly uncommon, but a skunk or a dog can get bat rabies. But really, we're focusing on these reservoir species having their reservoir variant. And then we have vectors. So vectors can play a role in transmission, but typically a minor and short-lived role. So a vector doesn't have its own established rabies virus variant, but can be infected and can be infectious, and by nature of ecology, epidemiology, and virology is able to spread the virus. So, for example, we have a cat. So a cat gets infected by a dog or a bat. That cat could potentially transmit this to another individual as a dead end or incidental host, or to another individual who could then transmit it. But these transmission cycles tend to be very short-lived. We'll go to a vector and maybe there's more transmission. It's often the end of it. And then we have our incidental or our dead end hosts, which there's not a 0% chance of transmission, but it's close to negligible for most species, our livestock, and humans would be there. And they can be infected from reservoirs or they can be infected from vectors, but with the greatest risk being from reservoirs, because that's where the virus is largely present in nature. So just to maybe reinforce that a bit, we have rabies susceptible species, and that's basically all our mammals. We have a rabies reservoir, and these are the species that maintain the virus in circulation. They don't need other species, they can maintain it themselves. We have our vectors that can transmit it, but don't maintain the virus in nature themselves. They require spillover from a reservoir. Can be involved with short-term transmission, but it is short-term. And domestic cats would be one of the main species we're concerned about there. And then we have incidental hosts, or often dead end, or typically dead end hosts. So a species that's susceptible gets infected by a reservoir or a vector, but does not typically transmit the virus. And that could be partly because they don't get a lot of virus shedding in saliva. It could also be because of their interactions with other animals that make it less likely for rabies virus to be spread, because the ability of the animal to expose another individual depends on behavior and a variety of other factors, not just the biology of the virus. And this was covered a little bit before, but again, just to remember, when we're thinking about transmission, whether it's a reservoir or a vector, we have a fairly short-term period where we're worried about transmission. This virus is maintained in reservoirs, and the majority of reservoirs that harbor this virus are not diseased yet and are not infectious yet, right? They get exposed, they get bitten, the virus migrates the nervous system up to the brain, then migrates down to the salivary gland. It's not until the virus is migrated to the brain that could cause clinical disease, and until it migrates to the salivary gland that it can become infectious. So within our reservoirs, we have actively infectious, actively clinically infected individuals, but we also have a large, really larger pool of individuals who are incubating this virus and will become clinically affected and will become infectious, but they aren't now. So your majority of individuals that are infected, whether they're reservoir or not, are non-infectious, and it's this period right around the onset of disease where we have the risk of transmission. So if we think about our reservoir species, there are a few things that have to be present. And this is relevant if we think about other reservoirs, if we think about elimination of rabies from reservoir species. So obviously they need to be susceptible to the virus if they're a mammal, but some mammals are more susceptible than others. They need to be able to produce large amounts of rabies virus in saliva, so when they're infected, they're producing enough they can transmit. And a big component is their social, behavioral, or host density aspects that allow them to continue to transmit it. If we have a very solitary species, they can get infected, but the odds of them infecting another individual within that fairly short period when they're infectious, which may just be a couple of days, is limited. So we really need species that live in large populations, mobile populations, have close contact, and contacts of a nature that can transmit the virus for this species to be a reservoir. Like I said, solitary species that don't have that type of interaction, even if they had a variant that was very amenable to infecting them, we're probably not going to see them being a reservoir because the ecology and the epidemiology doesn't fit with that. So as mentioned before, bats are probably the true primary reservoir for lyssaviruses and rabies virus, but the viruses evolved to have various and typically mammalian reservoirs. So within each of these reservoirs, there's their own variant species. We've got Arctic fox rabies variant, we have raccoon rabies virus variant, canine rabies virus variant. This doesn't mean they can only infect the reservoir species, but these are viruses that have evolved to be effectively transmitted within that reservoir and are good genetic markers for what species a case came from. So the rabies virus variants refer to their circulation, not their host range, because bat rabies variant can infect mammals just like any other rabies virus variant. So if we look internationally, there's diversity in the reservoirs that are out there. Canine rabies is the most common cause of human infection and human death, and it's dominant in areas where those deaths occur. So Asia and Africa. If we look in some other areas, we see Arctic foxes foxes. And in North America, we've got a bit more of a complex epidemiology. In the New World, we have bats, a variety of bats. And bat rabies is much harder to control than terrestrial rabies. Just an example, though, for North America, just so where I am, and if you can see my pointer, I'm in this area. We've got kind of this confluence of a few different variants, which is somewhat unusual. Typically, if we look here, there's a major virus variant. It could be skunk variant. We've got raccoon variant along the east coast of the US. I'm here close to the Canadian-US border. And we have Arctic fox rabies that comes down from the north. We have raccoon rabies that has come up from the US, and we're currently trying to eradicate. We have skunk rabies, and we have bat rabies everywhere. But in most places, there isn't this mixing of virus variants. And overall, you've heard this probably from every talk so far. Dogs are the prime source, whether it's 95% or 99%. They are by far the most common source of human exposure and human rabies. And we can think about why, because this gets into how do we control it? We need to understand why reservoirs are reservoirs. So there's an established canine rabies virus variant. But we also have large populations with frequent new additions. There are a lot of new births. There's a lot of movement between dog populations. So there's an ability to keep this virus propagated. If you have a small number of individuals that are very dispersed, they can't. You have a large number of individuals, new ones coming in to replace those that die, movement around areas between groups. This is how we maintain it in circulation. From the human aspect, they have close contact with human habitats. They live with us or around us. Even wild canids have close contact with urban and suburban areas. So we've got pets, we have feral animals, and we have wild animals. But all of these canids do have the potential for close contact with human habitats and with people. And all of them have a high tendency to bite. And that's not just when they have furious rabies. It can be when they're aggressive. It can be when they're fearful. It can also just be when they're playing. And part of this is kids, right? I mentioned the burden on children. Children like to interact with animals. Dogs tend to be a species we interact with a lot. And there can be bites from a variety of different circumstances. What's interesting about canine rabies is when it's endemic, it tends to be the only rabies virus variant that's around in terrestrial animals. So if we look at these two maps here, the bottom one is canine rabies. So red is obviously endemic. The top one is wildlife rabies, where you see that the areas where we have established endemic, hyper-endemic canine rabies, we don't tend to have as much wildlife rabies. And within an area, if we have a lot of canine rabies, spillover into terrestrial wildlife will occur. And it's usually the canine variant spilling over. It's typically not a parallel wildlife variant occurring. Versus some other areas where we don't have canine rabies, we have one or more wildlife variants to consider. Now, I'm not going to go over all the different reservoirs. I just want to highlight a couple of different things. This is from a paper, if anyone's interested. It's got a detailed list of reservoirs and of vectors. But if we look at North America, in some areas, domestic dogs, but it's been eradicated from most places of North America. So we have skunks, we have raccoons, we have foxes, we have a variety of mammals, and then a large number of bats, including the little brown bat, which was a rabbit bat that I had in my house actually a few years ago with potential exposure to family and animals there. South America, domestic dog in some areas, and foxes being the primary wildlife reservoir, and again, a variety of bats, including the vampire bat. If we look at Africa, dogs dominate in most areas. And there are some other potential reservoir species. There's some debate about some species, whether they're reservoirs, whether they're common vectors, with unclear how much it's circulating within those populations. So there probably are some other animals that are on this reservoir list, but dogs are the dominant. Asia, same thing. We've got dogs. We have a variety of other canids that can be involved. And that's really the take home, is most of our species are canids, potentially felids, but they have close contact with people, even if they're wildlife species. Which raises the question, okay, could we have new reservoirs? Are there reservoirs out there that we don't know about? And as we change our interaction with nature, human expansion, movement of animals, movement of people, climate change, all these things that are changing how we interact with our world, is there potential for new reservoirs? And there always is. I don't think we're going to see somebody that's going to come in and displace canine rabies as the big problem. But there are potential other reservoirs that are out there. And this comes back to what makes a reservoir, and then how can we maybe mitigate that? So we need to have the virus in that population. So you need to have spillover into vector species that might be amenable for reservoir. And those species have the social and behavioral aspects that allow them to continue to transmit it like a reservoir. And then that rabies virus probably has to adapt to make it more effective, shedding more virus coming out in saliva. And that species has to be present, like I said before, at a high enough density that it can continue to circulate this virus without that virus burning out in the population. And there are various species you can make arguments that this could occur. So that was reservoirs. Let's go to vectors for a minute. So vectors play a limited role overall, but an important role in some areas, and a more important role in areas where you don't have as much canine rabies, or canine rabies is well controlled. So a vector species gets infected from a reservoir species and can expose people or other individuals. And this comes down to a few different lifestyle and behavioral aspects. So they tend to be maybe a little bit less able to transmit it, but they're able to pick it up and have some circumstances where we could be exposed. So they have to have a potential for exposure to rabid animals. So there has to be wildlife or domestic dog rabies or wild dog rabies. And they have to survive the encounter. So we could look at, there'd be a variety of small mammals that are at great chance of having an encounter with a rabid animal. But your average squirrel or rodent that has an encounter with a rabid animal probably doesn't survive that encounter. So they're unlikely to be a vector species. They're more likely to be prey and killed or eaten in the process. So they've got to be exposed. They have to survive that encounter so they can subsequently develop rabies. And then they've got to have exposure to humans if they're going to pass it on to us. So this gets a fairly narrow range or types of species that could be involved. And usually we're looking at these mid-sized predatory species that live in close proximity to humans, and cats are a big option there. Dogs are also included in this. So dogs can be vectors. So dogs are reservoirs where canine rabies is present. Where canine rabies isn't present, dogs can be a vector. They're not going to be established reservoirs in that area, but we see a dog-skunk interaction on the bottom here, which can lead to a lot of bad things, but also rabies exposure. And we've got a cat raccoon in our area. This would be one of our main concerns for infection of a cat as a vector species. So there are a variety of vectors. And again, I won't go through the list, but you can look in Africa, domestic dog, if we don't have dogs as the reservoir in that area, but cats being the big one. It was mentioned before as cats being the second most common source in most areas of exposure. But you can see there are a variety of species, tend to be kind of these mid-size carnivore species. So same thing in Europe. One that's interesting, I just mentioned in Africa, the greater kudu, which is the animal pictured on the bottom left there. So this is an aerodactyl. It's a really unusual species to be considered a reservoir, but potential reservoir, but there is some evidence that it might be, which would be quite strange considering it's a very different species, very different encounters, but it has been shown to be a vector, and maybe it's one of these species that could be a less understood reservoir. Okay, so how do we control this? Really briefly, rabies control really focuses on reservoirs because that's where the virus is present most commonly. That's where it's circulating. That's what we need to address if we can. And obviously with wildlife species, it can be a challenge. Vaccination is really the key when it can be done. Vaccination against rabies is highly effective in animals. We can get usually fairly long-lasting vaccine response for rabies as opposed to some other diseases. And there are a variety of ways to do this. As an example for Mission Rabies, going in and vaccinating actually a pretty massive number of dogs. Also questions about oral vaccination. I saw there was one in the Q&A there, and the role of oral vaccination of dogs is an area that is quite interesting and needs more exploration, because that's something that's very commonly done for other species. So if we look in my area, so I'm in Canada, we don't have canine rabies. We have skunk rabies, we have fox rabies, and we had an incursion of raccoon rabies that we had eliminated. And it came in from the US, from a raccoon that probably hitched a ride on a truck, established a resurgence of this strain in the country that is currently being eradicated and should be eradicated, but it's a 5 to 10 year process. So, and one of the key components of this is oral rabies vaccines. So these are baits. You can see the bottom left. It's a live vaccine. It's a recombinant vaccine, and it's kind of a flavored covering. And these are deposited in different areas. They're put in bait traps. You can see here, these raccoons are reaching in, pulling out a bait, and some raccoons will eat a lot of these. Some very well vaccinated raccoons. There's oral hand baiting, so people walking through, putting baits in areas where we know there's a risk or around an area where we know there are cases. And the bottom right here is dropping baits from a plane. And they get dropped by plane or by helicopter outside of urban areas. There is potential for human exposure, but the risk is really low from that. So this is one of our key controls for rabies in our area. Rabies control in vectors really focuses on rabies control in reservoirs. If the reservoirs are controlled, vectors are less of a concern. The risks are mainly from reservoirs. But the risk from vectors really varies with the epidemiology in the area. And there may be places where controlling this through vaccination of domestic vector species is particularly important, especially in cats. But understanding the relative risk from reservoirs and from vectors and thinking where the best economic case can be made for vaccination of reservoir species or vector species. Ideally, we would do them both, but an understanding of the epidemiology in the area is important to understand how much emphasis to put on one versus the other. But vaccination of domestic vector species is an important component in many areas. So just to wrap up, as you know, all mammals are susceptible to infection, but it varies, and that plays into part of the reason why we have reservoirs versus vectors versus our dead end or incidental hosts. Rabies reservoir species are the key. They maintain it, they transmit it. They're the reason we have vector species. They're the reason we have incidental infections. But we can't ignore the vector species. They're uncommon, but with rabies, we can still have this important relevance of uncommon sources of transmission. Transmission is typically from animals with fatal infection. I didn't get into the question of, is there subclinical infection? How commonly is there subclinical infection? It's probably a minimal player in transmission, but something we can't dismiss. Spillover can occur from one reservoir to another, but really we're focusing on that reservoir circulating that variant within its own population. And the variant doesn't matter from a clinical impact. It doesn't matter if I get exposed to canine rabies variant or bat rabies variant or raccoon, it's bad for all of them. Controlling rabies reservoir species is the key, but vaccination of domestic species can also be an important public health tool, and particularly important in some areas. So with that, I'm always happy to take questions if anyone wants to contact me, but we'll have some Q&A time at the end, hopefully. So thanks for the invitation, and of course, some chatting later.
Now our last speaker is Professor Nissreen Elbadway from ZagaZig University in Egypt. Nissreen will talk about One Health perspectives for elimination of rabies, and emphasizing at the same time the modern technology as tool in this respect. Dr. Nissreen, is a professor of medical microbiology and immunology at the Department of Medical Microbiology and Immunology, Faculty of Medicine at ZagaZig University, Egypt. She is a consultant of immunotherapy and immunology, investigator in molecular biology unit, and consultant of infection control in the same university. Thank you, Nissreen. Please go ahead.
Fatma for this invitation. Thanks my colleagues for sharing and attendance. Finally, and not final, One Health approach is very important for rabies elimination. In first point of concern, I would like to explain One Health approach is a multi-sectorial collaborative transdisciplinary approach to achieve optimal health outcome, recognizing interconnection between people, animals, plants, and shared environment. These activities must work locally, regionally, and globally to obtain their objectives. One Health approach concept emerged due to growing of the population and the expanding of their location to become in more close contact with wild and domestic animal. Also, climatic changes, warming globe, and increasing humidity increase likelihood of transmission of disease from animal to human. Movement of people and traveling activities increase in last decade and increasing the chance of transmission of disease between animals and human. As a result, due to emergence of zoonotic infection, emergence and re-emergence of multiple zoonotic infection, 4 organizations united for developing objectives and strategies for rabies to eliminate rabies by 2030. These organizations include World Health Organization, Food and Drug Organization, and Organization for Animal Health, and Global Alliance for Rabies Control. Their objective to reach 0 by 2030. via effective use of vaccines, medicine, and diagnostic technology for rapid diagnosis and investigation of rabies among people and animals. Also to generate and measure the impact of their activity, sustain and commitment and resources for the application and the implementation of elimination strategies. This plan drew stepwise approach to rabies elimination. Stepwise approach is a planning, monitoring, evaluation tool to guide rabies control program. This approach is designed to include multiple activities and 5 stages and 7 components. 5 stages starting from assessment, elimination, control, and maintenance of their activity. Each step of plan including multiple activities to be measured and given score from 0 to 5. This stage begin as stage 0 endemic for dog-mediated rabies and reaching stage 5 free from dog-mediated rabies. These elimination strategies must engage multiple stakeholders to be involved in elimination process as ministries of health and agriculture, healthcare workers, veterinarian, dog owners, bite victims, and also media. It's very important for education and awareness. The 4 strategies determined by this united organization for rabies elimination and control start first with preventive. Preventive medicine and prophylaxis, it is the most important line of defense against rabies in both animal and human. Also rabies surveillance in human and animal, sustainable awareness and health literacy program, including not only public health, but also medical personnel and paramedical personnel, sustainable coordination among all sectors involved in elimination plan, and ecological factor analysis and control. Rabies prevention and control in animal and human, it must start with vaccination. In human, by education and awareness, pre and post exposure prophylaxis, also dog vaccination to decrease the number of cases of rabies among dog and among animal and among also human. Also animal birth control. Animal birth control is very important to decrease the number and the ratio of animal regard the human population by surgical and chemical sterilization. The second step, or the second strategy for rabies elimination and control include surveillance study. Surveillance study must include human exposure by determination of human exposed to the animal and the ratio of animal to human. Also surveillance of human cases as diagnosed by suspected cases, probable cases, and confirmed cases. Suspected cases with clinical manifestation, probable cases with clinical manifestation and history of exposure to raped animal or unknown origin animal, and the confirmed cases including cases with clinical manifestation and confirmed by laboratory investigation. Investigation of outbreak by the baseline percentage and the prevalence of disease, also by increasing the percentage of prevalence in certain season at certain period of time. Surveillance of animal population, including a number of animals and the attitude of animals and the number of killed animals around in a specific period. Also vaccination coverage. To reach vaccination coverage of animal by 70% is very protective and decrease the incidence of human rabies even after animal bite. All these surveillance study and data must be connected from people, community, environment, from healthcare workers, from animal care workers, multiple sources to be. These data must be standardized and analyzed in a logic sequence to obtain decision making about controlling outbreak and decision making for post-exposure prophylaxis to decrease the costs of unnecessary post-exposure prophylaxis and put a plan for further control with decrease raped cases, decrease cases of rabies. Rapid exchange of information must be done among all stages. Any strategy, whatever, education, prevention, vaccination, surveillance study must be done, any strategy about 5 to 10 years to be effective and to obtain their objectives. Sustainable awareness and health literacy program, including what is the knowledge must be delivered, how it is be delivered, to whom it will be delivered. Knowledge must containing wound reservoir of rabies as a pet, and the source of rabies as dog, wound washing and after caning and wound categorization, also post-exposure prophylaxis, anti-rabies vaccine and immunoglobulin. This knowledge also must containing environmental factors affecting transmission of rabies and must containing dog species, dog demographic data, and dog vaccination coverage. Also, dog vaccinated and non-vaccinated must be marked. This information must be delivered to a specific target group as frontline medical staff and paramedical staff about hand wound washing, about complete course of post-exposure prophylaxis. To fill the gap between standard information required for rabies control and rabies elimination and rabies prevalence, and their knowledge, attitude, and practice toward rabies disease and its danger and post-exposure prophylaxis. We can also remodify this education process, respecting the strong religious belief of specific population to obtain maximum efficacy and efficiency of this education to all individuals. This preventive education must starting with influential group, as the education is the best weapon to change our world. This preventive education could be delivered via several materials, including leaflet, 2 pages leaflet only, containing the basic information about rabies virus and rabies disease, clinical manifestation, dog vaccination, post-exposure prophylaxis. Also, it can be delivered to a specific and important target group as school children in their curriculum, school curriculum, or via mobile application, multimedia applications on mobile, on laptop. This is the education. The fourth strategy for rabies elimination, including sustainable coordination. Coordination have multiple levels among different organizations across the disciplinary network, including regional, local, and international. Different organizations concerned with human health, with animal health, and with environmental control. Multidisciplinary, including physician, including veterinarian, including environmental personnel and educational institute, and the most important, and administrative authorities to support all activities performed. Ecological factor analysis to determine the factors affecting reservoir and the host of rabies infection, especially vampire bats, which increase breeding, especially in high temperature and high humidity and low altitude. Also, to include all the data regarding free roam dogs, including their number and their ecology, demographic data, and waste management studies. About 70%, as we say before, 70% vaccinated, it will protect the individual and the population, or even if there is in close contact with animal. Here we have an important tool in One Health approach for rabies elimination, which is artificial intelligence. Artificial intelligence, it is human mimicking cognitive activities by machine, including deep learning and machine learning, to obtain data, recognize data, and managing data categorization and analysis. Finally, decision making. Decision making requires intervention and wound management, investigational tests, which is required or recommended, and even communication between different sectors, health sectors, human health sectors, animal sectors. They include artificial intelligence application, rabies elimination, including multiple modalities. One of these modalities, animal monitoring system, to record and check number of stray animals in a specific geographic area, and vaccination coverage, and also animal attitude and animal behavior. It consists of multiple components such as sensor and camera to snap the animal in a live position. Okay, if it is a live surveillance, this is one of the biosurveillance. Another surveillance to animal and animal immune status by the serosurveillance and termination of protective antibodies in the animal. Also, GPS system to provide the network to locate the stray animal is a very big important. Previously, we can determine the vaccinated or marketed the vaccinated animal from the unvaccinated animal. Here, GPS can control and market and making mark in the vaccinated animal to assess the vaccination coverage. Raspberry technology to monitor the animal behavior. Also, database which is automatically extracted, categorized, and analyzed for decision making. This is the animal monitoring system. Give complete information about the number, the vaccination coverage, the attitude, the number of killed animal, and the population increase. Also, one important tool in artificial intelligence application, including integrated bite case management system. Integrated bite case management system, it is a software in the computer containing multiple sectors, including health sectors and animal sectors and community. Each sector is supplied by a software to report any bite cases from animal, whatever raped or not raped. These interconnected to each other and supplied with certain resources and give certain activities. These three levels, community, animal, and human, affected by report and surveillance forum to report any bite. After that, analysis of the bite and analysis of the geographic distribution of raped animal to analyze the risk assessment, low risk or high risk, then take action plan according to the risk assessment after registration of this pipe. And all the communication and the data interchange between these three levels, including also capturing of this animal safely. The animal must be kept for 10 days, and after that it is free from rabies, it is released, and it is after 10 days any sign appear on this animal, euthanasia of animal, and the lab investigation which is recommended. If post-exposure prophylaxis is recommended, is done by referral from health sector to pharmacist to obtain certain immunoglobulin. All these application and the connection between animal community and the human sector help in decision making for proper decision, help in diagnosis, help in counting and surveillance study of rabies in certain geographic area, also decrease the unnecessary post-exposure prophylaxis. Also, ChatGPT. ChatGPT, it is generated pre-trained language to convert our natural language into a process, into a multiple process, even in decision making. This application helps to identify the potential research topics to assess the professional, clinical, and laboratory diagnosis. So it's help in diagnosis and the guidance for algorithm to specific diagnosis, and they know the update and the new development, if there is new update and development, such as rapid diagnostic test, lateral flow assay for rapid detection, in comparison also with the gold standard technique for rabies diagnosis. Also help to enable chatbot-based system for symptom checker. It analyzed by a certain forum or a certain questionnaire, recognizing the symptoms with certain score, then summation of this score to make finally symptom checker and for final clinical decision, support not only the patient but also the doctor in his diagnosis. GPT-4, it is the latest version of ChatGPT, more creative and collaborative. It permits us to enter multiple patient data regarding all demographic data and the clinical history and the present history of the patient and the exposure environmental surrounding. This is connecting these data, analyzing the data, and assess the clinician for suggesting of different differential diagnosis and give vulnerable treatment and management strategies. This all artificial intelligence application modalities in rabies elimination help to save time, to save efforts, and to save also cost of post-exposure prophylaxis, and give us accurate diagnosis and accurate management strategy, and also we can measure this output of these strategies. Thanks very much, Dr. Fatma.
Now the floor is open for questions. Please. The anti-rabies immunoglobulin, is it taken once for life, and doesn't need to be repeated if the individual has been bitten more than once by the animal? This is to Rehab. Dr. Rehab, please answer this question.
I think he thought that the attendee who asked the question, the side effect or something like that related to the rabies immunoglobulin, the indication is clear. First of all, you asked about repeated exposure. So he already have completed the post-exposure prophylaxis before or not? Yes. 3, so it's immune. Unless it's immunocompromised, so we can't rely on the immune response. If it's a category 3 with severe wound and bleeding, there is a risk. And this is risk assessment, and accordingly we can give rabies immunoglobulin. So there is no fear of the side effect of rabies immunoglobulin to withhold it just for fear of its side effects. There is a risk. Assess the risk, search for the indication, give the rabies immunoglobulin when indicated. That's it.
Okay. The second question is rat bite an indication for rabies vaccine?
Yes. And also Professor Morales have answered the questions for the attendee. Yes, the rat bite is indication for vaccine. Post-exposure prophylaxis like.
Okay, would you please let us hear your answer, Professor Alfonso.
Again, I agree with Rehab. In general, animal bites and considering the risk according to the stratification is important to consider. What I would like to agree is to try to search to establish the risk category, which is important to consider. If it's, for example, in the highest risk, for example, people that are in high risk areas, for example, or people dealing with, for example, who works in laboratories where there is work with liver concentrated rabies virus, or the other categories that have been stratified, especially people that are handling, for example, animals, including not only bats, but in environments where you may have, for example, bats and other wildlife animals that may be of risk for rabies. So that is important in the consideration case by case and individual approach. Nevertheless, in general, for the case of rats, this will be considered as an indication for the risk that may have in different parts of the world of exposure for rabies.
Another question to Nissreen. How accurate is using chat GPT for purposes you mentioned?
Its accuracy is not determined until now because it's only used for COVID-19 diagnosis, and it needs the clinical history, detailed clinical histories from the patient and the doctor intervention and multiple sectors. Is not till now is not approved for accurate diagnosis of rabies.
So it
it's
is
promising tool.
Yes, it's a promising, still is a research topic,
Yes.
not yet approved 100%.
Yes.
Okay, there is a question from Aisha Shitio Said. She wants to ask if this is also Rehab, if rabies is curable, and if so, which antiviral agents are recommended for the treatment purpose.
There is no approved antiviral specific for rabies. However, ribavirin have been tried clinical trials for it and succeeded for certain clinical regimen. And literature goes for going through the benefit of this using ribavirin and ketamine and other CNS stimulator. This is a combination of antiviral CNS stimulator and other clinical regimen. But there is no approved or successful, 100% successful antiviral treatment for rabies, not proven yet. It's a trial fail sometimes and succeeds in another.
Okay, thank you. There is another question from Dr. Sultan Al-Nakhli. How would you evaluate the efficacy of using artificial intelligence tools in mitigation measures of rabies? Nissreen, and if any of our respected speakers want to comment, welcome. Nissreen, please.
The only system applied in rabies diagnosis and the surveillance study and rabies management is integrated bite management system. Is very efficient in diagnosis, is very efficient due to communication between multiple sectors, including intervention by human. Integrated bite management system is very efficient in diagnosis and intervention measure. Also, animal monitoring system is very efficient. ChatGPT is still under investigation, but integrated bite management system is very efficient in diagnosis and intervention. Animal monitoring system is very efficient also in surveillance study and in management also of a rabid animal.
Thank you, Nissreen. There is another question from Hasnain Sajad. I hope I am pronouncing the name in a good way. What do you recommend for combating rabies in developing countries?
prevention is the best way for prophylaxis of any disease. So education and awareness in developing countries is very important. Education and awareness, and it's very easy via paper, leaflet, and mobile application, which has widespread in our community. Also, school education session and the influential group is very important. So education and awareness, it is the first and easiest tool for prophylaxis.
Yes, there is something
Health
important.
literacy.
Okay, health. There is important how we can implement One Health perspectives in developing countries. As you see, it's still not well developed in many countries. But how can we push the implementation of One Health perspective or One Health measures in these developing countries which have not yet practice this regimen? Or
elimination of canine rabies. Start with elimination of canine rabies, animal control and animal vaccination, and the surveillance study, education and awareness with very limited resources.
Thank you. Okay, Veronica Gutierrez, also please accept my apology if I'm not pronouncing rightly. She is commenting in Mexico, the application of oral vaccine in dogs from rural communities was carried out and the results were effective, but it doesn't replace parenteral vaccination. So
well, I can maybe comment on that, Fatma. Yeah, it's a combination effort that's going to be needed. So oral vaccines can be highly effective, and they can be widely distributed. It's very labor intensive to try to catch dogs and vaccinate them. And it also creates risk to the people. If you're trying to get feral and wild dogs, every time we're handling them, trying to vaccinate them, we're risking a human exposure to rabies with that. So for wild populations, oral rabies vaccine could be very effective, and it's been very well shown for other wildlife reservoirs to be effective. For domestic species where parenteral vaccination is an option, parenteral vaccination is going to be preferred, including serial vaccination if we can do it over time, because of the known highly effective nature of the vaccine, and it's probably somewhat more effective than an oral rabies vaccine. So I don't think it's ever going to be one or the other, but oral vaccination has a much greater chance of reaching this 70% goal. 70% is a lot of dogs in an area, and it's a lot of rapid turnover. And if we go in and vaccinate a lot of dogs parenterally once, 6 months later, there may be a lot more unvaccinated dogs. So it's a combination effort.
Thank you, Scott. A question is to Alfonso. What's your attitude to Wisconsin protocol for rabies treatment?
Well, there are many things I would like to add. First, I would like to return to the question of One Health and to mention that it's important to consider not only the role of human and animal health, but also we have to integrate the importance of the environment in this, remembering that One Health approach is environmental also, and this right now is integrated in the surveillance in certain countries regarding the distribution of wildlife species as well animal behavior, among other things. So that integration, I think, is important. Regarding the Milwaukee protocol, it's still important, but the problem is that in general terms, it's very complicated once the rabies infections is properly affecting the central nervous system to save the patient at that point. So that is part of the problem, and also in that way, I think that the most important cure, in fact, is the prevention of rabies in human as well, prevention especially in dogs, which is the goal of the 0 by 30 to eliminate the dog transmitted rabies and deaths and cases associated with.
Okay, thank you, Alfonso. There is another question from Ahmed El-Hijan, Dr. Ahmed El-Hijan. Is there any research on how we can prevent rabies virus to transmit from nervous system to salivary glands, like be working on the receptor peptides of both the virus and salivary gland cells?
Yeah, sure. There are many research on that, but still this is a preclinical research that has been not yet prove with the interventions in clinical trials, not even phase 1. So this is something that would be expectable as well in the case with potential antivirals, as has been, for example, discussed by Rehab and mentioned, for example, in the case of ribavirin and other candidates, but yet not proved and not FDA approved.
Thank you, Alfonso. There another question also from Dr. Ahmed Kashkan Inkia. Do we have any insights for rabies vaccine correlates of protection among humans? Is the antibody or T-cell driven, and is it an antibody or T-cell driven protection?
This is vaccine virus and the vaccine immune response, both for virus antigen. We have neutralizing antibodies, and sure, we have T cells and memory T cells, and we are depending on the memory T cells for the protective effect, which we need to cover the years before after the vaccination. Both are cell-mediated and the humoral immune response are targeted by the vaccine.
I think, Nissreen, I like to listen to you. Are expert in immunology.
Humoral immune response, neutralizing antibodies immune response, also cell-mediated immune response presented by CD4 and CD8. They are responsible for long-term memory immunity. Antibody fed with time, even after 2 years after vaccination. When we measure neutralizing antibodies, it will be reach 0. It is valid only for 2 or 3 months after vaccination to reach the protective level 0.5 international unit. After that, we are depending on memory T cell.
Okay, please, Alfonso, I'd like to hear to listen to you.
It's the same. It's a antibody mainly, but also there is a part of the T cell protection the driving force.
This will be the last question. Can one dog infected once with rabies virus has probability of survival? Is the infected dog can live after infection, getting infection, or it's not, or it is a fatal infection for dog? I think, Scott, you are the right one to answer this.
Here, I'll take that. I think if it comes to clinical rabies, we expect to be basically 100% mortality. If you look at seroprevalent studies, you can find antibodies in reservoir species in different areas. And the question is, how much of that is true infection? If there is subclinical rabies, it's probably low-level exposure, aborted infection. So there is some background degree of exposure that doesn't result to disease. But once they've got the disease, I would consider it invariably fatal in a dog.
Okay, thank you. I think the time now is over, and many thanks are provided to you from many of our colleagues who watched the webinar, and we thank all our respected speakers for their very interesting talk, and I hope also this time will come when rabies is no more present in our whole world. Thank you, and you can register in the YouTube of ISAC to be updated on any new information. Thank you again, and wishing that we have presented a valuable, interesting webinar. Thank you.
Thank you very much.
Thank you.